Good morning. My name is Dorothy Fintan, and this morning I will have with me here a 24-year-old woman that called me, and on the phone she was angry. She was she talking so fast. She has these racing thoughts. When I calm her down and I told her, let's take this one at a time. Why are you calling me? And she said, because her husband and friends wants her to seek help. That's why she's calling. And I said, okay, what's going on? And she told me a lot of stuff, that her husband calls her psycho, that she doesn't have time to sleep because she has a lot of things that she has to do, that they are upset at her because she is smarter than all of them. That's probably why they are upset at her. So immediately she tells me all this. I figured that she might have a bipolar, and I decided to make an appointment and ask her to come in this morning. So I decided, if really she has a bipolar, I'm going to use three types of therapy on her on different occasions. I'm going to use cognitive behavior therapy. This therapy involves assessing the thoughts, beliefs, and actions of the patient. The main aim of the therapy is to change the client's thinking as well as unhealthy behavior pattern. The other type of therapy that I'm going to use will be interpersonal therapy. This therapy focuses on assessing the individual's interaction with people that might result in psychosocial issues. The main aim of the therapy is to change how the patient interacts with other people to overcome certain problems. The third type of therapy I will use will be the family focused therapy. This therapy assesses the patient's interaction with the family members. It aims at improving family relationships, and it is very helpful in addressing issues that may affect the mental health of a patient. Why do I use all these three therapies? Each therapy is used to improve the mental well-being of the patient. However, it is essential to make use of all three therapies rather than one or two. Using all the three approaches does not only help in identifying the thought patterns, but also the interaction patterns of an individual. As a result, it is possible to come up with the most effective solutions that can be used to improve the psychological well-being of the patient. Issues that might be experienced when working with the clients during the therapy. One of the challenges include counseling reluctant patients. Some of the patients may not be willing to open up fully, making it very challenging to come up with effective solution. Besides, it can be quite difficult to build a rapport if one is working with a patient that does not open up. Another challenge that I might experience when working with this patient is the inability to set relationship limits. Therapists are charged with the role of ensuring that their relationship with patients is strictly professional. However, some patients may be experiencing problems that may require the therapist to build a close relationship in order to address the client's issues in the most appropriate manner. In this case, coming up with techniques of setting relationship limits can be quite challenging. how the modalities help the patient with a different culture. The use of the three types of therapies is of great importance in helping patients with a different cultural background. Therapists use the approaches to assess the problems being faced by a client without necessarily focusing too much on the culture or the belief of the individual. However, a therapist might choose to make use of the client's cultural belief and values during the therapeutic process to come up with the effective solution. Integrating the culture of a patient into the therapeutic process has been proved to be a very important practice. In conclusion, using the three therapies does not only help to improve the psychological well-being of a patient but also interaction with other people. Therapists use three types of therapies to ensure that they help their clients overcome various problems that might lead to issues related to mental health. Thank you very much. Let's wait for her arrival. Hi, Miss M.E. How are you? My name is Dorothy Fenton. I'm your therapist for today. Welcome.
Thank you.
Do you understand and give consent for these sections to be videotaped and audio taped and be submitted to Brahman University?
Yes, I give my consent.
Thank you. I spoke to you yesterday on the phone regarding the issues that you were having. What brings you here? It seems like you know yourself pretty well and have thought a bunch about what you would like to talk about.
Well, everybody says that I am easily distracted. I believe them because sometimes I feel as if my thoughts are running away from me, so I speak out loud and fast because I know I am very intelligent and highly respected. I spend a lot of money on poor people. Like the other day, I went shopping. I bought this nice blouse worth $650 and gave it to a homeless person.
Hmm. Have you ever seen a counselor before? You seem pretty comfortable and confident coming in here and talking about the challenges in your life.
No, I have not. But my friends and family think that I am weird. And I need to talk to someone. That's why I am here.
What is the problem from your viewpoint? Everyone has a different perspective on what the problem is.
I do not see any problem except that sometimes I do not need any sleep so as to put my thoughts together and faster.
How does this make you feel?
I don't know. Sometimes I feel bad the way I talk back at my family and friends. They recorded me sometime and I felt bad for being that explosive.
Okay, um, there is an illness. It's not an illness, but it's like a psychological issue that they call a bipolar. And with this, it's easily treatable. I will give you a worksheet and we are going to use behavioral therapy, cognitive behavioral therapy. This therapy, it will make you to know what you're doing well and what you're not doing well. The first thing I want you to do is to stabilize your routine. This means I want you to engage in activities on a regular and predictable basis. In other words, I want you to establish a rhythm to your day. This will help you to stabilize your mood. For example, the time that you exercise, the time that you sleep, and the time that you eat. And then this worksheet, when you have stabilized your mood, this worksheet, I want you to write down how you feel every day, in the mood every day, from 0 to 10. 0 means you are depressed, 5 means you are feeling okay, and 10 means you are highly irritable or your mood is elevated. And I will see you in the next 2 weeks, okay?
Okay, thanks. I will try to do the worksheets and I will see you in
Thank
2
you.
weeks.
Thank you and have a nice day. Hi, Miss M.E. Welcome back. How are you?
I'm good.
Can I have the worksheet? I see a lot of 5, which means your mood was okay. Can you tell me about it?
I followed what you said I should do. I'm stabilizing my mood and recording it, and I felt that having a routine was pretty
And
good.
it turned out okay.
Yes.
Perfect. That's good. So the next thing we will do is called interpersonal therapy. This therapy involves this almost the same thing. You write out the time that you're supposed to do something. Then you write down the time that you actually did that thing. Like going out with your friends, if you tell them that you will be there by 12 p.m. for lunch, then you write down 12 p.m. Then you write down the time that you actually met up with them. Is it by 12:05, 12:10, 12:30? Then you write them like that. And then I want you, when you're doing a task with people, you write 2. When you're doing it alone, a task alone, say I want to get out of bed by 9 a.m. That's with you alone. You write 0. That means you alone. When you're doing it with people, and then I want you to rate your energy level from day to day. With this worksheet, you write them out. This therapy, again, is called interpersonal therapy. What it does is it change how you interact with other people to overcome certain problems.
Thank you.
This is the worksheet, and I will see you in the next 2 weeks.
See you in 2 weeks.
Thank you. Hi, Miss MD. I see that you're back.
Good morning, Miss Dorothy. This is my husband, M.E.
Hi, MA. How are you? My name is Dorothy. I'm the therapist. So, can you tell me a little bit about what's going on between you and ME?
How you doing, Dorothy? Well, for starters, one minute she's overly happy, and next she's sad. Her emotions are all over the place. She never allows me to talk or express how I'm feeling.
Okay.
And yeah.
How about you?
Well, he never listens to me. He calls me a psycho sometimes when I am trying to make a point.
Okay. So, how does this make you feel?
It makes me feel bad because I feel like he thinks that I am more intelligent than him, so he doesn't want me to talk.
Okay. You guys are here for what we call family therapy. Does she tell you everything that we discuss at the therapy each time?
No.
Okay. We've done 2 therapies in a row. And this is the third one and the final one. And you are involved in this. What you do, since you said that she has high moods and low moods, in one time she is sad, that's a very low mood, and in one time that she's overly happy and all that, okay, that's a high mood. It would be better if you are a good listener when she is in that highly happy mood. Listen to her, to what she's trying to say. Being a good listener is the best thing that you can do for her with the kind of problem that she's going through. You just have to be a good listener and try to calm her down when she is overly happy, going about spending all that money. You calm her down in a calmer way. Instead of going shopping, if she tells you, I'm going shopping, I want to do this, you can calm down and tell her, what do you want for dinner? What are we going to eat for dinner? To take that thought of going shopping away from her. If she's sad when she is in a low mood, you can go to her and said, what movies would you like to watch tonight? With the kind of problem that she's going through, I want you to know the signs and symptoms of this problem. And this is called a bipolar. The signs and the symptoms of is sometimes she will feel overly happy and high, as if she is racing, her thoughts are racing. She might go out and spend thousands of dollars on somebody or on something that she will not even need. You just have to find a way to distract her and calm her down. And on the other side, she will not even sleep. She feels like sleeping is a waste of time because, as she said, that she is more intelligent than you or something. That's not her talking. That's the problem. Okay, all you need to do is to calm her down. You need to record and figure her out and know the signs and symptoms when she is trying to be talkative. If she talks too fast, being talkative, you calm down and know that the symptoms are coming. If she is like easily distracted, you know that the symptom is coming. If she is not the wife that you married, you know that the symptom is starting to come. And then you will now say, honey, have you been doing what the therapist asked you to do? Have you been keeping the logs, the worksheet, and all that? It seems to be helping her, and I want her to keep it up. So this is the third therapy, and all the first one that we did and the second one was with her alone, but this one is called a family therapy. If you help her, these three therapies go hand in hand. She will easily overcome this problem. You will not see it again. What you will see is the happy woman that you married. Do you have any question?
No, ma'am, I don't.
Are you willing to help her go through this?
Yes, I am.
Thank you very much. Is that okay with you?
Yes, ma'am.
Thank you very much.
Thank you.
And have a nice day.
You too.
Don't forget to call me if you guys have any other issues or problems, okay?
Okay.
Thank you.
Thank you.
And have a nice day. In summary, The patient has three types of therapy. These therapies help her to improve her relationship with her husband, with her friends, and with her mood. She improves her inner self with the cognitive behavioral therapy. She improves her relationship with her friends with interpersonal therapy. She improved her relationship with her husband with family focused therapy. These three therapies work hand in hand to improve the patient's overall well being. In conclusion, using the three types of therapy does not only improve the psychological well being of the patient, but also the interactions with other people. Therapists use the three types of therapies to ensure that they help their clients overcome various problems that might lead to issues related to mental health. Thank you very much.